Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss hemodialysis catheters and how to keep it working well. Hello doctor, welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, what is a hemodialysis catheter?
The catheter used for hemodialysis is a tunneled catheter because it is placed under the skin. There are two types of tunneled catheters, cuffed and non-cuffed. Non-cuffed tunnel catheter are used for emergencies and for short periods, you can say up to 3 weeks. Tunneled cuff catheter is a type recommended by National Kidney Foundation for temporary access. It can be used for longer than 3 weeks when an AV fistula or graft has been placed but it is not yet ready for use. There are no options for permanent access. For example, when a patient's blood vessels are not strong enough for a fistula or graft, catheters have two openings inside. One is a red arterial opening to draw blood from your vein and out of your body into the dialysis pathway. And the other one is a blue venous opening that allows clean blood to return to your body.
How can one take care of catheter?
By taking good care of your access, it will last longer and will prevent problems such as infection and clotting. Some important steps are: keep the catheter dressing clean and dry. Make sure that the area of insertion site is clean and your care team changes the dressing at each dialysis session. Keep an emergency dressing kit at home in case you need to change your dressing in between treatments. Ask your dialysis care team to teach you how to change dressing in an emergency situation. Never remove the cap on the end of your catheter. Air must not enter the catheter. You can shower or bath if you have a clear dressing that sticks to your catheter site and the skin around it. This type of dressing is recommended because it's waterproof, which helps prevent infection. And because it's clear, you can see signs of infection. You should avoid letting the catheter or catheter site go under water during a bath. This would increase the chance of moisture getting near the catheter site, which can cause infection. Wear a mask on your nose and mouth anytime the catheter is opened to prevent bacteria from entering the catheter and your bloodstream. Professionals changing the dressing should always wear a mask and gloves as well. The caps and clamps of your catheter should be kept tightly closed when not being used for dialysis. Only your care team should use your dialysis catheter to draw blood or to give medications or fluids. If the area around catheter feels sore or looks red, call your dialysis care team at once. Ask your dialysis team about signs and symptoms that require immediate attention.
Doctor, are there any concerns about a catheter?
Sometimes, even when you're very careful, your access may clot or become infected. Clots can form inside the opening of the catheter or from the outside of the catheter and block the opening. This can cause blood flow at a slower rate than the rate your doctor recommended. If the blood flow rate remains low for more than one dialysis treatment, the catheter should be checked and treated the same day. Early treatment may prevent the clot from totally blocking the catheter. It is important to restore the recommended blood flow rate and treat clots that are forming so that your catheter continues to work well and you get the amount of dialysis you need. Infection can also occur with a good blood flow rate. It is important to follow your catheter care instruction as you are taught in order to avoid infection. You should know the following signs and symptoms of a catheter infection and report them to your doctor or dialysis care team right away, so you can get a proper treatment as quickly as possible. The signs and symptoms of a catheter infection include fever, chills, drainage of catheter exit site, redness or tenderness around the catheter exit site, general feeling of weakness and illness. Treatment depends on the type of infection but may include an ointment applied directly to the infected area if it is an exit site infection, antibiotic medication if there is a drainage from exit site, and intravenous IV antibiotic if the infection has spread to the blood.
What will happen if the catheter is not working well?
A decrease in the blood flow rate ordered by your doctor is a sign that the catheter is not working as it should. If this occurs for more than one treatment a week, the catheter should be checked. Lower blood flow rate will cause you to receive less dialysis. You will need a longer than usual hemodialysis treatment to get the proper amount of dialysis. Another sign that a catheter is not working well may be the pre-pump arterial pressure alarms. These sounds notify the care team that your catheter or your vascular access is not allowing a free draw of blood. This can be a sign that a clot is forming in the catheter, blocking the flow of blood.
What can be done to remove the blockage from the catheter?
The treatment is the administration of a clot bursting medication called tissue plasminogen activator (TPA). Most dialysis centers can give the medication while you are in your dialysis chair, thus preventing a hospital visit. If you are at the end of your treatment, TPA can be given just before your next dialysis appointment. Ask your doctor how this medication can be given before your next treatment session. If the clot is not treated when the signs and symptoms of an early clot are found, the catheter may progress to be fully clotted. You may be then required to visit the hospital or vascular lab to have the catheter checked and possibly exchanged for a completely new catheter.
What can I do to keep a catheter working well?
Learn as much as possible about your prescribed treatment plan, your blood flow rate, how often and how long you need treatments. Follow a treatment plan. Book your appointments beforehand. Stay for your full treatment time. Arrive on time for your hemodialysis treatment. Ask your doctor how much dialysis you should be getting. Keep a record of your URR numbers. Talk to your dialysis team if your numbers are not as good as they should be. Share your concerns with your doctors and dialysis team. You may want to ask some of these questions. How can I tell if my catheter is not working? What is the flow rate my doctor ordered for me? Why does the flow rate of my catheter need to be at this level? If the flow rate should go down, will I be given clot dissolving medication? Will the clot dissolving medication interrupt my dialysis treatment? If so, what will happen to the rest of my treatment? How will you put the clot dissolving medication in my catheter? How long do I have to wait for it to work? What are the signs and symptoms of infection?
Doctor, what message would you like to give to our listeners?
The National Kidney Foundation recommends the AV fistula as the preferred choice for permanent vascular access. The catheter is recommended for temporary access. There may be conditions that prevent you from having a fistula or a graft, and a catheter may be used. Following the above guidelines to keep it working is at most needed.
Thank you, Doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that this talk will be of great use to our listeners.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.